Are you thinking about therapy? Maybe you're stuck in one or more aspects of your life. Maybe you have some kind of symptoms that are bothering you or getting in the way of you living your life to the full. Maybe you're battling to adjust to some kind of change. Maybe you have an issue from your past that's kind of haunting you, bothering you. There's often some kind of fear that's holding you back in one or more ways in your life. A lot of people come to therapy because they have some kind of problem that they want to discuss, they want to talk through or process. These are all very common reasons why people consider therapy, and they're all good reasons. My name is Karen. I'm a clinical psychologist from South Africa using a combination of psychodynamic psychotherapy, cognitive behavioral therapy, also known as CBT, narrative therapy, which is kind of about stories and the stories that we tell about ourselves and to ourselves, and solution-focused therapy. I also have a secret weapon. It is called brain working recursive therapy, or BWRT for short. And BWRT is a relatively new neuroscience technique that speeds up the process of healing to quite some extent. In this video, I'm going to explain my approach, what I offer you, and how you'd benefit from working with me. In the first session, I will meet with you, assess you by asking loads of questions so that I can come up with a treatment plan that is individualized and customized for you and what you need. With the judicious application of BWRT, if you and I decide that that's what we're going to use as part of our treatment plan, then you can expect to see significant shifts in the right direction for you within 8 to 12 sessions. So what does it feel like to enter a therapy process with me? I offer a structured approach for those first approximately 8 to 12 sessions. A safe, therapeutic, confidential space for you to express yourself. I will set clear therapy goals with you to make sure that you and I are always on the same page. I give lots of feedback. I like to share my thoughts as we go along and my reflections on how I see what is going on for you. I'll help you to develop coping strategies as we go along. If you and I agree that it's appropriate, then I'll use brain working recursive therapy, which is a neuroscience evidence-based therapy technique that physically alters unhelpful patterns in your brain. My specialties are executive imposter syndrome or ordinary imposter syndrome, because you don't have to be an executive to feel like an imposter. I work a lot with relationship stuff, especially patterns that echo from things that happened in our childhood. Women's health with an emphasis on fertility issues, IVF, difficult pregnancy, and postnatal or postpartum depression. And following on from that, one of my most cherished specialties is post-traumatic growth, which is all about how we make meaning and process our most difficult experiences and even use them to grow. And last but not least, I work with neurodivergence and all the issues that come from having a differently wired brain. Of course, I also work with all the usual anxiety, depression, and adjustment issues that crop up in pretty much everyone's lives. I see a range of presenting issues from the small everyday problems of life to the more serious and severe mental health problems. As a clinical psychologist, I come from a more medical approach, and I work closely with specific psychiatrists if that is something that is indicated. I only see a limited number of clients because I want to offer you my most focused, individual, and best attention. There's a link to a contact form in the description below. Please click on it, drop me your name and details, and I'll be in touch. And if you'd like to know more about BWRT and how that works, then please click on the video which should be showing somewhere around about now. Thank you so much for watching.